When we think about body fat, we usually focus on the fat we can see and pinch. This soft layer directly under our skin is known as subcutaneous fat. While subcutaneous fat is often a cosmetic concern, there's another type of fat that is far more dangerous. This hidden enemy is called visceral fat, and it lies deep within our abdominal cavity. Visceral fat wraps around vital organs like the liver, pancreas, intestines, and kidneys. Today, we will examine the scientific evidence surrounding the severe health risks of visceral fat. To understand its danger, we must look at how visceral fat behaves metabolically. Unlike subcutaneous fat, visceral fat is not just a passive energy storage depot. It acts as an active endocrine organ, constantly releasing hormones and inflammatory substances. Visceral fat secretes inflammatory chemicals called cytokines, such as interleukin-6 and tumor necrosis factor. These inflammatory signals are released directly into the portal vein, which flows to the liver. This direct delivery route exposes the liver to high concentrations of fatty acids and inflammatory chemicals. The constant influx of these substances causes the liver to develop insulin resistance. In response, the pancreas must produce higher amounts of insulin to manage blood sugar. Over time, this chronic overproduction of insulin can lead to type 2 diabetes. High levels of visceral fat are also strongly linked to non-alcoholic fatty liver disease. When the liver becomes packed with fat, it struggles to perform its essential metabolic functions. The liver begins releasing excess cholesterol and triglycerides into the bloodstream. This alteration in blood lipids increases the risk of plaque buildup in the arteries. Consequently, individuals with high visceral fat face a significantly elevated risk of heart disease. Visceral fat is also associated with high blood pressure and chronic low-grade inflammation. This systemic inflammation can damage blood vessels and increase the risk of stroke. Even in individuals with a normal body mass index, excess visceral fat poses major health risks. This phenomenon is often referred to as being thin on the outside and fat on the inside. So how do we determine if we have high levels of visceral fat? While magnetic resonance imaging is the most accurate method, it is too expensive for routine checks. Fortunately, a simple waist-to-hip ratio is a highly reliable surrogate marker. A high waist circumference relative to hip size is a strong indicator of excess visceral fat. The good news is that visceral fat is metabolically active and easier to lose than subcutaneous fat. Clinical research has identified several highly effective strategies for reducing visceral fat. First, we must address dietary factors, specifically the consumption of added sugars. Liquid fructose, found in sodas and processed juices, is a primary driver of visceral fat accumulation. When we consume fructose, the liver metabolizes it directly into fat. This process leads to rapid fat deposition in the liver and abdominal cavity. Replacing processed foods with whole foods is a critical first step. Next, physical exercise plays a vital role in mobilizing deep abdominal fat. Studies show that both aerobic exercise and resistance training are highly effective. Regular physical activity increases the expression of enzymes that break down visceral fat. Additionally, we must consider the impact of stress and sleep on our hormones. High stress levels trigger the release of cortisol, a hormone that promotes abdominal fat storage. Cortisol increases the activity of lipoprotein lipase, an enzyme that pulls fat into visceral depots. Prioritizing 7 to 8 hours of quality sleep helps regulate cortisol and growth hormone. Growth hormone helps stimulate the breakdown of fat cells, counteracting the effects of cortisol. Minimizing alcohol intake is another key strategy for reducing liver and abdominal fat. The liver prioritizes processing alcohol, which halts fat burning and promotes fat storage. In conclusion, reducing visceral fat requires a comprehensive approach to lifestyle. Focus on whole foods, regular physical movement, and effective stress management. Small, consistent daily choices can lead to a significant reduction in deep abdominal fat. This is general information, not medical advice, so talk to your doctor for specific plans. Empower your metabolic health by aligning your daily habits